Coming to Swanee as a freshman from Shelbyville, Tennessee, I did not consider myself a local. However, during the first year program, Finding Your Place, I recognized my hometown and Swanee's surrounding areas, rural, historic, and complex. I was immediately drawn to the idea of working closely with the people who were motivated and dedicated to bettering their communities. My work as a Bonner has primarily been at a nonprofit clinic in Tullahoma, Tennessee. Partners for Healing serves Franklin, Moore, and Coffee counties. As someone who doesn't live far off the plateau, I feel a deep connection with these people because we share common ground, both culturally and quite literally. The work I was doing became more personal. This was my community that the clinic was serving. A primary motivator for choosing to attend Swanee was the student opportunities for community service. I enrolled with plans to pursue a pre-med track, go to medical school, and become a pediatrician. In my first few weeks at Swanee, I knew I wanted to get involved with the Office of Civic Engagement, so I signed up for one of the spring break outreach trips to go to Haiti. One of the most exciting aspects of the trip was touring a rural Haitian hospital opened by Paul Farmer, a physician and co-founder of a global health nonprofit called Partners in Health. After seeing rural medicine in a developing country, I began thinking about the similarities between their healthcare system and the available medical systems in Appalachia. My recent exposure to rural medicine in a developing country without a doubt inspired me to continue in my pursuit of a degree in biology, while also serving in medically inclined capacities. This is what drew me to work at Partners for Healing. I wanted to have firsthand experience working with healthcare providers in a rural setting. As a biology major, I felt a disconnect between what I was learning in the classroom and what I found most fulfilling: community engagement. When the Certificate for Civic and Global Leadership was announced, I knew that was the bridge I needed to connect my academics and Bonner work. If anything, I was really beginning to recognize the important connections between nearly all of my experiences at Swanee, as a Bonner, living in the community engagement house, participating in the philanthropy internship, and my coursework. It became apparent to me that everything I was putting my energy into was not directing me towards med school, but rather towards a career in public health. I wanted to continue working in the nonprofit sector while creatively using my background in biology. My passion for service work continued to grow, and I became more intentional in the projects I pursued with an increased feeling of purpose. The summer before senior year, I interned with the National Diaper Bank Network on their new initiative, the Alliance for Period Supplies. After this experience, I was thinking of ways to incorporate the research skills I had cultivated. Soon after returning to the domain, I began working on my required capstone for the certificate program. One of the most impressive things I learned that summer was how to foster partnerships and curate a network of similarly focused organizations who could learn from one another. Keeping this in mind, I designed my capstone project to create a live, updatable online resource directory with the guidance of a coalition of healthcare and social services called the South Cumberland Health Network. The overall objective was to maximize already existing efforts, where providers could collaboratively increase access to adequate healthcare on the plateau. It was such a rewarding experience that felt like the culmination of all things I've learned during my time at Swanee. I truly cannot express how fortunate I feel to have worked with a network of community members whose passion for serving their community is so evident in the work they do. I've also been able to translate much of what I learned through this year-long process into program development at Partners for Healing. While most of my Bonner and academic work has revolved around healthcare access, I'm so glad I've still been able to find ways to integrate my experiences in Swanee, Haiti, and New Haven in many facets of life. I attribute much of what I've been able to accomplish this year to the support I have felt from the clinic's executive director, Lynn Brumfield. Her vision for the clinic enables me to be creative and adapt what I know about care coordination and collaborative efforts between nonprofits. Together, we have been developing a patient advocacy program to fulfill areas of our patients' lives that our clinic may not be able to address directly, but that we can through partnerships. We believe that connecting our patients with resources like housing assistance, financial management courses, and food aid will likely increase their overall health. By addressing social determinants of health, we can more efficiently help our patients target areas hindering them from living healthy lives. This is how we build our capacity in our relationships with not only the people we directly serve, but also with peer organizations who are also working towards creating a healthier community for all. I have been given tools and space to reflect on these experiences, and in turn, I've developed an even greater passion for nonprofit work to make healthcare accessible for the growing community that I consider home. I value everything that the Bonner Program and the Office of Civic Engagement has done for me over the last 4 years. Many of my experiences as a Bonner at C'20 have affirmed and validated the significance of my community engagement work. I am so excited to implement the lessons and skills this work has taught me in my next steps after graduation as I seek new opportunities and dedicate myself to a lifetime of service.